Gauteng Health Department has denied the province's public hospitals have a financial or food supply crisis. This following concerns raised by staff at Hani Baragwanath Academic Hospital around bread supply shortages. Gauteng Health MEC Nomathemba Mokheti says the issue has been resolved. Many of the 8,500 medical workers hired to alleviate COVID-19 cases will soon be out of work, as the department says it doesn't have the budget to retain all of them. The department held a briefing at the Baragwanath Hospital earlier today. Lindokuhle Xulu was there. He's back in studio with us. So let's talk about the issues, because there were concerns about not paying staff on time, now having to let go some of the extra staff that were hired, to food shortages. Is there a crisis in the Gauteng Health Department or not?
According to the department, there is no crisis. In fact, the CFO of the department said that there is not even financial crisis. What they are saying they're dealing with is, in fact, a backlog in terms of paying some of their suppliers. So just in terms of the finances of the department, they said at the beginning of the year, they began this year with about 59 billion, and that they've spent almost 80% of that, and those were used as well to in fact pay for some of their service providers. So they're saying there is no financial crisis. At the moment, they find themselves with about 10 billion rand that they still need to use towards the end of the financial year. It is, of course, closer to that because we know that the new financial year will begin in April. So they're saying they have managed to pay some of their service providers. This was about 5 billion rand that needed to be paid. But even as things stand, every day the health department incurs or accumulates some of the debt that they would normally pay to their service providers. So they stand at a 4 billion rand debt, but they're saying that they have an understanding at this moment with many of their service providers in terms of when they will be paying them and how they'll be paying them. So in terms of the long and short answer of it, they said they do not have a crisis. They just had an issue with paying some of their service providers because of the fact that there were a backlog in terms of payments. But now everything is sorted out.
So you said they still have 10 billion to use before the end of the financial year, but
yes,
they don't have enough money to keep these 8,500 workers on. Well, not all of them at least.
So the answer to that was given by the CFO again, saying that the 8,500 nurses as well as hospital staff that was hired during the height of COVID-19, there was a grant budget that was allocated to them. That is why and that is how they were able to hire these staffers. But they're saying that because that particular contract ends at the end of this financial year, they do not have money in their coffers to actually continue to hire them. But what they've said as a positive they've been able to do is to get 1.1 billion rand, which is just a little bit under the 2.5 billion rand they got the last time when they were hiring these 8,500 employees. So what they are saying now is that with that 1.1 budget allocation for the new year, what they'll be able to do is to hire at least half of these 8,500 workers that are out of a job right now. So that's that recruitment process that will be happening together with CEOs as well as other high management in the health department. They'll be consolidating who they need most and prioritize those areas in terms of the COVID response. But let's take a listen to the CFO just explaining to us what is it that they'll be doing with this new 1.1 billion that they've gotten from government.
By end of February, we had recorded at least 8,500 personnel, clinical staff and also administrative support combined. 8,500 recruits that we brought in the system, whose contract is now ending now on the 31st of March. So based on the budget allocation that we had, remember the DG spoke about 2.2 billion that we had on recruitment of these personnel. There's about 1.1 billion that is now going to be given for the year 2022-23. That is the year that's starting now in April the following month. So we can only talk to plus minus 50% of what we can now employ as part of recruitment process for COVID-19 patients.
All right, so Hani Baragwanath was basically one of the reasons we heard from the MEC today, because there were pickets outside there yesterday about what was happening, including issues around staff having to buy bread for patients. What is the hospital saying about that?
Well, the hospital, first of all, said that they want to commend those that were nurses in some of the wards that were buying bread for some of the patients. But what they were saying was that there was no shortage of food. What was a shortage was in fact a gripe with a service provider of bread that did not deliver because they were not paid on time. And that would mean for the hospital that they need to substitute that with other foods such as yogurt as well as fruits. But what the CEO explained was in fact to say that the problem was that the people that they service from the communities that they service preferred bread instead of other forms of nutrition. And that is why there was this issue where some nurses would then need to go and buy bread because they wanted them to stay nutritioned. So that is the issue, we understand. But now they're saying the service provider has been paid and that in fact those breads will be reaching the hospital every day. But the issue was that patients did not want other forms of food, they just wanted bread. But take a listen to the CEO as well, just explaining in terms of that choice from the patients.
We did not have any challenge with any other food items. Patients were getting their normal breakfast, their lunch and their dinner. But bread is necessary because dinner is served around 5 o'clock. Therefore, it's always critical that in the wards there is bread available for people to have snacks. It doesn't mean that we're not giving them other snacks because bread was not there. Especially people who suffer from diabetes, for example, they need to have snacks in between the meals. So with the assistance of our dietitian, snacks were provided according to, to the disease profile of the patient. But patients, I think they prefer to have bread. The community that we serve, they prefer bread. So even if we gave them alternatives, the unhappiness about bread still remained. But as a hospital, we had mitigation strategies in place.
Also, we also heard from Denosa yesterday about how they're being affected by the load shedding, in particular some nurses using torches to actually carry out procedures. What are health officials saying overall in the province?
Well, the health officers are saying that they are affected by load shedding. They're saying that they are not exempted from the rest of the public. But what the schedules does is prepare these facilities in terms of making sure that their generators are working and all of that. We know from Denosa that there are hospitals like in Sidibeng that have not been able to have those backup generators working. Well, the MEC for Health today said that that particular task of ensuring that they service those generators does not fall with them. In fact, it falls with another department, the Department of Infrastructure. So that is not the infrastructure. Yes, I think it is infrastructure, Shahan. So they're saying that they had alerted them to say there is such a thing. But one of the things I should emphasize is what Denosa said, to say that there is best practice that can be learned from the Western Cape, which generators are serviced each and every week. And they're saying that that is not happening now. But the Minister of the MEC of Health, in fact, today said it is not something that they can do. It's something that another department is in charge of. And that is why they just alert them to say that they must check these generators. But it seems best practice is not happening in other provinces.
I don't think she can actually say it's not really her problem because the hospitals are a problem. If they don't get power, then they can't do their job. So ultimately, she should be calling another department and saying, hey, get your act together because it's affecting us. But thanks so much for your time. Appreciate it. Lindokuhle Xulu. By the way, we have been trying to get a hold of the Gauteng Health MEC on the show, as well as the Baragwanath Hospital CEO. No luck there.